So I'm going to talk to you about what we do, and as I say, lots of you will be very familiar with that and how we do it. Perhaps most importantly, talk about our latest activities and also how we want to work with everyone in the room. So, what do we do? And these are messages that I repeat at all of our events. We're the only UK charity that devote themselves solely to supporting people who are at risk of severe allergies. And I think that's a really important point to reinforce. I know that many of you will know that the charity was established just over 20 years ago now by David Redding, whose daughter died from a severe anaphylactic reaction to food. And it started round a kitchen table and has got to the stages that it is today, which is a well-respected national charity. But we always keep our eye on what our key ethos is. We're a membership service, so we have individual members, corporate members, and also professional members. And one of the things I think we feel is at our core is we think it's important that we bring these three groups together, that actually we bring individuals, clinicians, but also the food industry and pharma, discussions with pharma, together, and we think we're the ideal conduit for that. We're an information and support service provider, and that again runs through our core. And every time we're thinking about new initiatives, what we're going to do, and when times are hard with regard to finance, which they are at the moment for everybody, but I think more particularly for medium-sized charities like ourselves, when I'm tempted to go down a path which might make us some money, which will encourage us to do more work, I'm drawn back by key members of our staff, and not least David Redding, who still comes in one day a week, and we pull back and say, why are we actually here? What's our ethos? What makes us different? And then we move on, and I don't get the money usually. We're a patient advocate, so we will stand up for the individual patient, and we get innumerable calls, emails, messages on our Facebook, Twitter, through to our helpline staff, and we are happy to talk to and help individual patients, even if the query is one that has come through umpteen times. Each time it's dealt with as a fresh inquiry, because people, when they're first confronted with, or even during the process of being involved with severe allergies, whether they're an adult or a child, can be very frightened. So I think that being an advocate and standing up for patients and helping the individual is still something we do. We're an educator. Mandy very briefly mentioned one of our online training courses, and I'll talk about that in a minute. And we're also a campaigner. And a couple of years ago, the Board of Trustees had a strategy day, which was really quite turned a corner for us, I think, because we started remembering that the Anaphylaxis campaign has its name because David Redding started it as a campaign. And we've had a lot of discussion around we should go back to campaigning as well as providing the standard support and information. And I think those of you in the room who are familiar with our work will be aware that that's something that's very important to us. My staff, I call them my staff, so many of them are in the room today, and we've had many changes over the years. Those of you who've seen this slide before might see there's another man. And in fact, yesterday, a third man started work with us at the Anaphylaxis campaign. So for years, there's been just David, but now we've got two new male members of staff. Bob Trice there, who's acting as our corporate relationships manager, and as an ex-CEO in the food industry, is invaluable in taking those relationships forward. And Peter Robson, because he only started yesterday, his pictures escaped, but he will be doing our trust fund applications. But a lot of those faces will be very familiar to people. And the other thing is, you can see we've got a younger element, particularly on our communications side, and Maddie is at the back of the hall, and we make a point of having someone very young to work in the communications team, because quite honestly, it's so fast moving, so many changes, that even a number of my staff who are a lot younger than me still find it hard to keep up. So we're very focused on trying to get new, younger members of staff to keep us up with that very important line of communication. Membership organisation. Our individual membership is falling. This is despite the fact that over the last 12 months we've said that anyone who becomes an individual member can have our online training course for families and carers free. And we used to sell that for £20 and membership is 19. So to me there's a logic. But I think when the Anaphylaxis campaign membership was at its peak, when we had about 8,000 members about 15 years ago, information was not freely available. It is freely available now. Some of it is not good information, some of it is not robust information, but people do feel they can get information. Therefore, the incentive to join an organisation as an individual member is not there, but 4,500 odd is not bad, and I think the message we give to those people is how brilliant it is that they're actively supporting us by becoming members. The majority are parents. Most people join us, they stay with us for about 3 years and they join us when their child is newly diagnosed. However, there is a new trend. The trend is that we're seeing more and more calls to the helpline, more and more messages through the website from people with adult onset allergy. And that trend is growing, and more of those individuals are actually joining us as individual members. So that's been quite an interesting change for us over the last year or so. Most people are affected by food allergy, which is what you'd expect, and primarily peanut. But we do emphasise that we cover all severe allergies: venom, drugs, idiopathic, latex. About 18 months ago, we absorbed, I'll put it that way, the Latex Allergy Support Group, which was a brilliant charity giving direct support to people with latex allergy. But in the current climate, being run by volunteers, on a very low budget, with lots and lots of goodwill, they couldn't continue, and they knocked on our door and asked if they could be absorbed into us. I took that as a huge compliment that they should choose us, because most of them had been involved for about 20 years since the charity was set up. And our work with latex allergy supporters has grown. But again, venom is something that's certainly the number of queries we're getting around venom are growing also. So, how do we support people? Our communications on and offline. We've got Facebook, Twitter, Instagram. As Maddie will tell you, we've got channels that they seem to change from one month to the next. Tumblr, all sorts of things. And they are extremely important. But our helpline is vital. And 2 of our helpline staff are here today. Moira, who leads that team and was the first member of staff to be employed by the Anaphylaxis campaign, I know everyone would recognise, gives an absolutely superb service, as do the people who work for her. So our helpline's very important. Support groups I'll talk about a little bit more in a minute. Webinars. We started having we used to have meetings, face-to-face meetings up and down the country, and we called them Meet the Medic. And they were successful. We'd get about 20 odd people, maybe 30 coming along. We tried to have them in areas areas where there wasn't a large allergy centre, or areas where we knew there were a number of supporters who were having difficulty getting support. And we got local clinicians to come, which was great, but we decided that they were very expensive to run. And even though the 20-odd people who entered those rooms had a fantastic time, we wanted to get the message out to reach others. So we've started having webinars. Some of you might have seen the webinar that was held a few days ago, which was given by Mandy and Moira, and was all about school issues. And we're still looking at how many people looked at that webinar, and I'm not quite sure how many it was, but certainly it was 58 people who registered, and it's now available online for anyone to see. So as you can see, we will be reaching out and giving information to more people. We know our demographic, with regard to our demographic, that 90-odd% have access to online facilities. So this does seem to be the right way forward. And there's going to be another one, Mandy can remind me, December the 6th, about Christmas issues. So look out for that. Watch them yourselves. They made a fantastic team. I'll embarrass them with that, but they really did. Having watched it myself, I thought it was very good. And also prior to that, we had one on adult allergy as well. So this is the way forward for us to communicate with as many people as possible. And we'll be looking for feedback, not only about what people think of the webinars from clinicians, individuals, as well as our corporate members, but also thinking about new topics. And I think this is a very good way forward. Also, we have our product alerts. And actually, this year, the number of product alerts has been frightening, far up on last year. And these come from food companies where there's been an error in packaging or inclusion of an ingredient. And we text our individual members who are affected by that particular allergen so that they have an immediate knowledge that there has been a product alert. But this year seems to have been not a very good year in those terms. So, our volunteers, and I love updating this slide because the numbers are going up exponentially, which is fantastic. About 18 months ago, we made the decision to take on a member of staff who focused solely on working with our volunteers, and that seems to have paid huge dividends. We've now got, as of yesterday, I think, 433 volunteers. They're all on a database. They're all, their particular skills, the way they want to help us, that's all logged. When I started with the Anaphylaxis campaign, we had 200 volunteers, I think, on the list, and somebody went through the list for me, and actually a lot of them were non-existent. But we actually know that these are 433 real people who want to work with us. We've got 181 live volunteers. What that means is these are volunteers who actively go into local clinics, GP surgeries, they put up our posters, and that's fantastic for us, and they spread the word about us as an organisation. And then we've got 45 support groups. About 2 years ago, if I was putting up the number of support groups we had, it would have been below 10, certainly. But again, our volunteer leader has worked very hard to increase the number of support groups across the country. And actually, we had a meeting in Reading a couple of weeks ago, and it was fantastic because virtually all of those support group leaders from across the country came in for a training day. And we had Professor John Warner and other clinical speakers and all sorts of presentations come. It was an overnight stay. We gave them a nice meal. It was sponsored by one of the adrenaline companies. And this was the second time we'd done that event. This year it was much bigger because we've got more support groups, and we're all already thinking about the event next year, which I think will be even bigger. That map shows you where our support groups are. And as you can see, there's some big gaps. Poor old Wales, the land of my fathers, is not particularly well served, certainly in mid, east, west and north Wales. And I know we've got a representative here from South Wales, and South Wales is brilliant, yes. However, with regard to support groups, we need a bit more. Similarly, typically with all allergy services, with a few notable exceptions, the further north you go, the thinner it gets. And these support group leaders do a brilliant job, and we regularly put calls out to on our Facebook, website, Twitter, and say, if there is someone who's interested, please let us know. It's quite a big job, actually. We give support, financial support for getting venues, etc. But it is quite a big job, and also people have to be trained, and we don't allow anyone to run a support group for reasons people in the room will understand. But nonetheless, they provide a very important job. And a trend in the last 6 to 9 months, maybe slightly longer than that, is that local clinical centres are getting involved as well. So they're offering medical speakers. Some of the support groups are actually meeting on the clinical sites, and there's more of an interplay. They're advertising the clinics for us. So I think actually that the support groups for us within the clinics and encouraging their patients. So actually I think this interplay, again, is very, very important and one we want to build on. Working with people like yourselves, and this is absolutely at our core. We don't have a big chunk of money to support clinical research, and I'm always envious of Kay, who's Chief Exec of Asthma UK, when I see their research funds, which are not inconsiderable. We have a pot of £10,000. However, what we do, as well as using that pot to help PhD students and master's students and people who are trying to learn more about allergy in the clinical world, we do also facilitate research. So we are one of the key partners of IFAM, which is the €9 million research project between clinicians and the food industry, which is drawing to a close in February of next year. And we've been absolutely key partners in that. The patient organisations involved in that Europe-wide project have been Germany, ourselves, and also Ireland. And we've played a key role, which we're very proud of. We have projects with allergy clinics. Scarcely a couple of weeks goes by without me being approached by a clinician, be they nurse, dietitian or a medic, saying they're going to take forward some research and would we be involved. And we're always, always happy to do that. And I think one of the sadder things now is I've looked at and reviewed various projects that have gone forward for research and they're not getting funding because of current circumstances. And I think that's very sad. But we do take our role in that very, very seriously. And if allergy clinics are just undertaking a small internal project, we're still happy to get involved with those. So, you know, people do contact us. We've got our clinical and scientific panel. And Andy here has been an absolutely fabulous chair. He can go red now, but that's all right. Fabulous chair of that clinical panel over the last few years. Never fails to support us. We don't meet that often face-to-face because we've got 20 of the top clinicians across the UK. So how can we get them all in a room? Very difficult. But there's lots and lots of online discussion. And I know if we have an issue and we want to debate it with clinicians, we have a path to those professionals, which is brilliant. We have our training programmes, the Allergy-wise suite of programmes. Linking project with the allergy clinics. By, I think it was about May of this year, I had rung every single allergy clinic across the UK, be it adult or paediatric, and I'd spoken to all of the lead clinicians for each of those clinics, had some really good conversations. Only, I think there were about 4 or 5 who said they didn't want to speak to me. I followed it through, but they still didn't want to speak to me. And only 1 clinician was rude. So I think out of about 100 odd phone calls, that's actually not bad. And I now, my embarrassment now is if I go to something like the BSACI conference where clinicians come up to me and they're very chatty because we've had long chats on the phone and I can't remember who they are. However, that was well worthwhile. And now when things happen at various parts of the country, I do have an address, a connection, a name, and people don't move around that much in the allergy world, so I think that was a project well worth doing. Also, we work with the BSACI, with IACI, with the BSI, British Society of Immunologists, the British Society of Dermatologists, particularly because around latex, and also the Organisation for Dietitians as well. And that's a very important thing for us. We're small, and as Mandy said, I think in her presentation, you know, we're stronger if we work together, and working with these organisations has been enormously helpful. So, corporate members, this is where the money is. We actually work very closely with the food industry. We've got 146, I think it is at the last count, corporate members. All the major food retailers, food manufacturers, the distributors, caterers, all the food industry, the big names are all part of our organisation and support us greatly, which is marvellous. And in addition to that, we work with their umbrella organisations. So we work with the British Retail Consortium, with the Food and Drink Federation, who are brilliant and host all our board meetings for free for us. So they obviously, you know, think we're valuable partners. And the Food Standards Agency, who we work with extremely closely. And I think that link with the food industry is so important. It's a link we've had for many years, actually. It's not something that is recent, but it's something that is very robust. We work with the pharmaceutical companies, so obviously the adrenaline distributors, the three main adrenaline distributors, but also with other pharma companies as well. And the number of pharma companies working with us is increasing as other pharma companies are taking an interest in the world of allergy. So that's a growing area, and they sponsor our events, sponsor various activities, and that's really helpful to us. And I find them really very easy to work with, which is great. What do corporate members get? Well, they get e-newsletters. They get horizon scanning, which I think we're going to be sending out to our professional members as well, which is looking ahead to what's happening in the world of allergy. And certainly in the food industry, they're particularly interested in this area. And it's a piece of work that's been taken up by David Redding, our founder. And I think he's finding it fascinating to do the research and try and pick up those new issues that we need to tell people about. They have conferences, they pay to come to their conferences, even if they're a member. Individual queries we deal with, they have fact sheets. So they're very important to us. They get product alerts, and they send us product alerts as well. And we also give them consumer feedback. And in fact, at our training day for support groups, there was an incredibly lively discussion with the chap from Marks and Spencer's, and he was talking about the food industry and labelling, and it was clearly a subject that the support group leaders in the room wanted to know more about. So we're in the process of setting up a webinar, so watch out for that, because I think individual members will find it interesting, but also I'm sure clinicians will as well, talking about developments in the food industry and the challenges that they also face. But we get individual queries about particular labels and whatever, and we have very good contacts within the food industry that we can take those queries forward. EU regulations, you know, the food labelling law that changed a couple of years ago, and some smaller companies are still struggling with that, and we respond to queries around that area as well. Work on thresholds and reference doses, which I'll talk about in a minute. And a new initiative for us, which we only started about just under a year ago, I think, we've now got a corporate food industry panel. Because rather like we have our clinical panel, we use a lot of experts in the food industry for queries, etc. However, we wanted to bring that group, the group together to talk about how we could better work with the food industry. And that's been absolutely fascinating. And in fact, I'll talk about our new campaign that we're launching in 2017. And that arose directly from discussions with the corporate food panel. And Hazel's at the back of the room, who's a stalwart member of the Anaphylaxis campaign, worked with us for many years, and she's also a member of that panel. But it's been a very, very useful development for us. So, working for better allergy services, I'm sure this is a sentiment everyone in the room would agree with. The NASG, led by Mandy, who works for me 2 days a week and 3 days a week for the NASG, and does an absolutely brilliant job in terms of bringing key partners together to try and get improved and more allergy services. The NASG has the BSACI on it, it has Allergy UK, it has ourselves, and it's supported by various industry partners, and it does a very, very important lobbying job. We have an all-party group in Parliament which takes quite a lot of looking after, and which the individual organisations on their own would struggle to establish such a group, and Mandy does that brilliantly. We also have parliamentary receptions, we organise parliamentary questions, and I'm joint chair of that group with Dr. Pam Ewan from Addenbrooke's, and I think it really does a very, very good job. We also have meetings with various government departments and have links with different departments like the Department of Health, Department of Education, also the MHRA, and those are very, very important to us. Having that link in to those key bodies is something that I think we value very highly. We're members of various working groups and national bodies, and certainly members of staff are part of NICE bodies, looking at NICE guidelines, NICE standards, etc. And again, it's very, very good that we are able to directly represent the patients on those bodies. That's great. And we work with other charities, both nationally and internationally. One of the things that I'm proudest of is that I'm an active member of the IACI Patient Organisation Committee, which is made up of countries all over Europe. And IACI has embraced the patient organisations in a fantastic way. Their president, Antonella Marano, actually ran a patient group in Italy, and she decided that patient groups were key to the way these organisations run, and we've never looked back, really. Similarly, I'm a member of something called IFAR, which is an international patient group, and I'm on the patient support group committee for that, and that actually has 30 countries on it, and it includes South American countries, Hong Kong, China. It's a fantastic body, and what we do is that we give support to countries, particularly some of the South American countries, where they don't even have adrenaline, and we help them to develop their programs, we help them to set up their patient organisations, but we gain an awful lot from them in return as well. I always laugh and say my 30 years in the NHS, I never went further than Belfast in 30 years. However, I've been all over the world with the Anaphylaxis campaign as part of this international work, and I think it's a fantastic element to what we do. That's just a bit about the people from last year, the number of people who contacted us. But I was looking at the data yesterday because we have a board strategy group coming up next week, and the numbers have grown exponentially. So actually, I don't think they'd let me put up the 2016 numbers yet, but they are incredibly higher than even those numbers. So our fact sheets, and I hope everyone in the room is familiar with them. They're overseen by David Redding again, and they're absolutely fantastic. I've no hesitation in saying our fact sheets are the best. They're better than anybody else's. They go through significant peer review. They're written by the national expert and sometimes international expert in each topic. It's like they're signed off, they're covered by the information standard. Why anyone would want to produce their own is beyond me. Use ours. They're freely available and they're brilliant. And that tells you a bit about the information standard. It's a bit like a cottage industry, and you're annually inspected and you have to log all your references and so on and so forth. But we think it's worth it. We think it's worth it because it does guarantee to people using our fact sheets that they are the best. And as you can see, we've always got new ones under review. The thing that always puzzles me is that the second most hit thing on our website is our fact sheet on banana. Now, don't ask me why that is, and I actually, when people tell me that, I tell them to go back and check. They must have it wrong, but it's true. People want to know about banana. So if you want to know about banana, our fact sheet is clearly very good. But we're developing other fact sheets all the time, and we develop them in response to queries we get on the helpline. We look at the information that comes in from the helpline, and we try to bridge the gaps that are there. So that's a very important element as well. Now, our latest activities, I'll make sure you do see Take the Kit. This is a film that's been around now for a couple of years. It's groundbreaking. We're still relaunching it. We're in for a couple of communication awards with it, and I have shown it across the world in various meetings where there have been international representatives, and it's never ever failed to A, to make people silent, but B, to get very positive endorsement. And in fact, in Australia, it's an official part of their clinicians training program, which is fantastic. But it's a brilliant film. We will make sure you use it. I know some clinicians do use it when they've got particularly difficult adolescents who are going on to adult services and just aren't getting the message of how careful they need to be. It was a big leap in the dark for us. We'd never made anything like that before, but I'm terribly, terribly proud of it. So we will make sure that we show it to you so everyone here has seen it. It's got some very simple messages, though you won't hear much talking. I know when I showed it, the Board of Trustees were enormously trusting when we produced this film because it was out of the comfort zone. And one older member of the Board of Trustees complained he couldn't hear the dialogue and it made him feel sick. And he couldn't hear the dialogue because they all mumble, but that's been great using it for international purposes. And it's filmed looking down because that's the way video games are filmed for young people. So it really is specifically tailored to a particular age group. But as I say, it's constantly being passed on. We constantly see other people relaunching it. And the messages are simple. Carry your adrenaline. Talk to your friends. Make sure that they understand what happens, what they need to do if you have an anaphylactic reaction. And don't be ashamed of it. You need to talk about, you need to communicate. And I'm sure that's what you say to all of your patients. But perhaps Take the Kit might help you get the message over if you choose to use it in your clinics. We're doing lots of work on thresholds and reference doses. One of the things that's coming out of IFAM is some absolutely fantastic, groundbreaking work around how you can set levels of allergen within a product that will not affect perhaps 99% of the population. I'm really oversimplifying that, and there's a lot of communication that needs to take place around this particular piece of work, but it's moving forward exponentially, and Andy is doing some brilliant work on this as well in a research project. We are very actively engaged with this work. Sometimes I struggle to understand the technicalities, but we are very actively involved with the patient voice, and what we will be doing, because we keep stressing the need for it, is there are huge positives for the individual patients coming out of this, not least around may contain labelling. However, we have to communicate to patients in a way that they will understand, and their carers, in a way that they will understand what is actually behind this. And that's a huge challenge when you've got some of the top clinicians and scientists in the world working on this. But it has to come back down to how we communicate it to patients and how we communicate it to people like yourselves and to all clinicians, because it's a big leap forward and it's complex. So that's certainly a challenge, but we're certainly up for it. We've had various surveys. We had a global survey which 17 countries took part in around the work that's taken place around thresholds across the world. And the message back from virtually every participant in every country was, we're not keen. And I quite understand that, because as you will know, every parent has the most allergic child and every individual is the most allergic person. So this concept is a difficult one, but at least we knew what we had to start with. There's another survey that's going out in the next week or so as part of the IFAM work, and that's going out to about half a dozen countries, and that is about, again, attitudes to precautionary labelling. May contain is the bane of everybody's life in the allergy world, the severe allergy world. We know that. But we also know that people make judgments. For example, if something says made in a factory or contains traces of or made on a line as opposed to may contain or whatever, they make value judgments on those statements. And actually, there's no scientific basis for any of them at the moment. So that's what the threshold work will address. So please, please watch this space. We'll be keeping everyone up to date in our bulletins, and we will try and explain it in the basic, simple way. In fact, Moira has just been responsible for the whole IFAM project for writing the guidance for patients and also for clinical professionals. And I know it's been a huge challenge to make a very complex topic into something that's clear and understandable. But watch this space. You'll see it first if you're members of the Anaphylaxis campaign. I'm also part of an expert group. This is where my scientific knowledge does sink. I'm a historian. The other part of my degree was English and economics, so I actually am not a scientist, and they have to keep re-explaining things to keep it simple for me. But in a sense, that's a good thing, because we're going to have to explain this stuff far more widely. So that's, you know, it's important. But that has been fascinating work. Hazel, who's in the room again, is part of that body. There's about a dozen of the top people across the world involved with this thresholds and severity and dose. So it's great to be at the table, and it's great that people are asking us to put the patient view. Our Allergy-Wise courses, which Mandy very briefly touched on, because we do have one for healthcare professionals, which is still selling well, which is great. We've got one for GPs and practice nurses, which is free to all GPs in Scotland. Thank you, Scottish Government, but not across the rest of the UK. And we do find take-up is low. However, it's taken up by a lot of independent GPs, interestingly enough. They're the main market for it. We've got a brilliant course for pharmacists, and what we are in the process of working with one of the adrenaline distributor companies, because what we want to do is make that course available free, if we possibly can, to every pharmacist across the country. I spoke at the National Pharmacists Organisation conference a month or so ago, and I did a quick test with them, with the clickers. You haven't got them today, but with clickers. And they had a quick check, and I was very, very concerned by the results to the very straightforward questions I asked. This is a great course. It could go out via the major retailers, by the big 5 pharmacists, also to independent pharmacists. So the course is ready, the course is there, written by, with Dr. Joanna Murphy, who's a consultant pharmacist and part of our clinical panel, but hopefully we'll get that out. We've now divided up some of our courses, so we have one for preschool children and one for school-age children, and also one for adults, because as I mentioned earlier, the growth of adult onset and the growth of calls to our helpline from adults is certainly a trend that's growing. And also we've done one for nursing homes, because everyone's getting older, and we are actually seeing people contacting us in their 60s with onset of things like peanut allergy. So we're trying to cover all the bases with those very brilliant courses. We're spreading knowledge about the European food regulations, which will still continue to cover the UK through articles in Outlook, and also by educating the allergic population as well. So this still, even though the regulations have been around for some time now, about 18 months, there's still a lot of work to do in that area. So, our campaigns, the new campaigns for 2016 was the number of adrenaline injectors prescribed. Very contentious issue. We are holding resolute to our position, which is that not everyone needs to be prescribed adrenaline. There's over-prescribing in some areas, under-prescribing in other areas. There needs to be more training. We all understand that. But fundamentally, we support the view that if you are prescribed adrenaline, you need to have 2 on your body at all times, and that's the MHRA and EMA position, which that's our position on that. Generic auto-injectors in schools, Mandy has told you all about that. I'll talk a little bit about AIM, and we also are involved with a prescription charges campaign, which again Mandy leads for us, and that's about people with chronic illnesses getting a better deal on prescription charges. That again has been a long, slow process, but very, very vigorous campaign, and one that we very actively support. So AIM, this was our big ticket item for 2017. Very tragic circumstances. There were a few young people who died, and one family in particular were really wanted us, raised a lot of money for us in in memoriam funding, and were keen that we should use this money to work with primary care, because their child had died and had not received a very good deal from primary care. So we set up the AIM campaign because we had a nice chunk of money for us, around £70,000 to devote to this. We took on a project manager, Tessa, who's in the room, and we were able to do this in a very focused way with fantastic support from GPs who have worked with the Anaphylaxis campaign over many years. And what we did was we managed to produce information and to disseminate it to every GP across the country with the help of MEDA and ALK, 2 of the adrenaline injector companies. And it was, the nice quality standards were there, the guidelines are there. The problem is a GP deals with so much that, and also, as we know, allergy isn't part of QOF, so they have to be really personally interested to be involved with this. And as a consequence of that, we wanted to headline the allergy information, and that was the purpose of AIM, which I think we did. I know certainly at least 4,000 GPs were directly contacted. Okay, there's about 38,000 GPs across the country, but 4,000, and that was a few months ago, and I'm sure it's more now, was not a bad hit rate. And we used the GP Press and the GP online facilities for that. These were the materials we produced. They're freely available on our website, and I know that they've been used and called down by other clinicians as well, and we're really pleased about that. So you've got a nice quality standard summary, you've got something for the waiting room, you've got posters, and these materials were all produced working very, very closely with GPs themselves, which is great. So if you want those materials, don't hesitate to use them. AIM 2 is now the next bit, and we're actively involved in developing that, because what we want to do is to approach it from the other end so that people know what they should be able to expect when they go to primary care with a problem regarding allergy. So we want to enable patients to have the knowledge to do that. Our problem is, we know that certainly our individual members, those who follow us on Facebook, those who follow us on Twitter, are probably well educated on these topics anyway. But when you think of the prevalence of allergy, you know there are so many people we're not reaching. So what we're going to do is make it a regionally based campaign where we will use local press, local radio, local clinicians. That's a big job and takes a lot of planning, and we're currently in discussion to get sponsorship to help us do this second part of the campaign, to make sure that we do it to the high standards that we do, we pride ourselves on. So there's our objectives. We want to keep driving the messages, but from the other focus, the focus of the individual. And also, this will encourage people to know about us. So even if they don't become members, they'll know about the facilities we offer, they'll know about our helpline, and they'll know that they can contact us for ongoing support. And there's some statistics there, which we did a big survey as part of AIM to find out about what was happening in primary care. Now, these people who will have responded will largely have come through our website, Twitter and Facebook. So they will be people who are probably more knowledgeable than a number of other people. But still, the statistics are concerning. 62% had no asthma review following their allergy diagnosis. 47% weren't really happy with the level of care. 28% were confused. Only 35% were given advice on how to manage their allergy. This is where it gets a little bit worrying, more worrying. 45% were given adrenaline, but only 19% were given training. We know we've got to educate pharmacists, but as a bottom line, if someone is prescribed adrenaline injectors, they should receive training before they walk out of that surgery. So that was concerning. Only 19% was given advice on allergen avoidance. Only 14% told their asthma was a risk factor, and 34% had a reaction between their GP appointment and seeing a specialist. So there's some very concerning stuff in there. Repeated in other surveys as well, that if you do a literature search, but this is the survey that we carried out. On the positive side, nearly 90% were referred to a specialist, which is fantastic. And nearly 47% only had one GP appointment before their referral. And because we get a lot of calls to our helpline from individuals who are going back and forth to their GP, we were quite heartened by that. But I suspect these are people who are quite knowledgeable, and have been in touch with us. So if we'd got more response perhaps from the general population, it might have looked a little bit different. Now, what's our campaigns for 2017? We're going to be focusing on the food service with advice from our panel, and we're going to have a campaign called Ask the Question, and we're going to focus on adult allergy services. So I'll just talk briefly about those two things. Ask the question. We know that people find it very difficult when they go into a restaurant or when they go to a bakery or when they buy food that is non-pre-packed to have the conversation about allergens. As a result, many people don't eat out or they take a risk. Equally, we know from the other side, the people behind the counter very often don't ask the right questions, and also, as a result, people can be given misinformation, or people end up just not buying the product or eating in the place. So we want to help the catering industry get it right. I'm told I must hurry up a bit. Bottom line is, we're going to introduce a campaign. It's going to be hard-hitting in the nature of Take the Kit, using all the modern techniques, which we will make available widely. So we're currently working on how that campaign develops. And adult allergy services, just very briefly, we know that adult allergy services are not brilliant across the UK, particularly in terms of dispersal. There's very little in Wales, 1 clinic in Northern Ireland, 2 clinics in Scotland, you know, not great. And we know these clinics are very, very, very busy. So we're calling 2017 the Year of the Adult. And we know it's a growing issue. We know there's patchy provision. Paediatric services, children become adults at 16 in the NHS, so they're part of this adult service gap as well. And we want to support, advocate and educate this group. We're not miraculously going to campaign for lots and lots of new clinics, and the NASG are already on that case. We want to help people to make the best use of what services are already there. How we can work with you, I think I've alluded to these things going through my talk, but please contact us. You are very, very, very valuable to us, both in terms of feedback from you and also in terms of being our ambassadors and helping us to get our message out there. Don't forget Wig Day. Last year was brilliant, a record year. More clinics got involved last year than ever before. We want to make this year, 2017, the biggest year yet. I think it's year number 5 for Orange Wig Day, and it's grown and grown every year. So let's have even more people engaged in 2017, and we'll be having a professionals conference. Thank you very much for listening.
Thanks very much, Lynne. Got time for one question, if anyone has one. There we are, yes. Wait for the microphone, please.
Thank you very much. That was really interesting. My name is Miriam Nicholson, and I'm an allergies nurse in an independent boarding school. We've got about 30 pupils who carry adrenaline pens, and one of the questions I wanted to ask you was based on or with reference to the other pharmaceutical industries getting involved. Compliance is a huge issue, irrespective, and I give them they have training every year, demonstrations and really in depth. They've been shown the video, but compliance is still an issue. And I wonder if the fact that it's such a bulky, big thing to carry around, is that being addressed? Maybe the size of the auto-injectors, as well as maybe some nice thing to carry them in. Just a thought for the teenage population, really.
You're absolutely right. And some of you may be aware of the LVQ device that was available in the States that was the size of a mobile phone and spoke to you. And that was withdrawn from the market for technical problems. though it was only available in North America, but is now coming back shortly into the North American market, which is great because it had great feedback. Unfortunately, it certainly, I don't think it'll be available in the NHS because of cost. It's costly. There's another device that's being developed by a company in the UK, and they came to show us this device a year or so ago, and they say it may well be available in 2019, and that's the size of a small cigar, which again is brilliant. There are all sorts of other companies developing things, wristbands that carry adrenaline, etc., etc. I think, unfortunately, we are where we are, because fortunately we have a fixed price mechanism for adrenaline in the UK, so it's affordable for the NHS and people can have access to adrenaline, but we're therefore stuck with the rather bulky pens. And I know carrying 2 of those is not the greatest thing. With regard to carry cases, we've looked at so many of these things, and there's lots of them available on the net. But to be quite honest, if you're a teenage boy, none of them are really the right thing. But I think there will be changes in the future. More and more companies are getting interested in this field. So I do think it's a case of a year or so down the line, things may well start to get better.
Okay, thank you very much, Lynne. Well done.